So hi, I'm Chris Law, I'm CEO of Umio, and in this video I'm going to introduce you to Umio's framework for designing transforming value in health, care and related social ecosystems. Now the framework is built upon ecological principles, ecology being the study of interactions between and within species and the environment. And so I thought, as one member of one such species, why not let's head outdoors and talk about each of the four components that make up the framework as I myself interact with the natural environment. So without further ado, let's do exactly that. So I've come to the local bird hide overlooking this lake because the first component of the framework concerns how to identify or frame individual health ecosystems. Because when faced with a complex system of any kind, I think the first thing we need to do is to find a way to break down the challenge into smaller parts. We need to reduce complex health and care systems into practically useful frames to capture insight, discover opportunities, and take valid, useful action. Fortunately, we can learn from ecologists who do exactly this. They break down the whole complex Earth ecosystem into smaller discrete ecosystems using common units or contexts to distinguish one from another. Well, typically these contexts are, first of all, a type of primary producer species that sits at the bottom of an ecosystem food chain. Now, they're called primary producers because they perform the vital role of converting energy resources, such as light, water and soil, into food resources for all other species in an ecosystem. Now, the presence, capabilities and health of primary producers really provides the basis for an ecosystem's existence, as well as its ongoing functioning. Now, secondly, the nature of the environment itself, whether, for example, desert, coastal or forest ecosystems, clearly determines the type, quantity and quality of resources available to the primary producer, and therefore also influences ecosystem health and its ongoing functioning. So what do these two contexts tell us about how we can identify and frame individual health ecosystems? So we can do so using very similar contexts as shown here. First, we can replace the primary producer species with a particular patient group, whether with single or multiple disease or condition states, such as persons with diabetes or heart disease, or both even. Or we can use a population group, such as the elderly, frail or newborn babies. And the second context concerns the characteristics of health and care resources available to an ecosystem. Now, these may be human, financial, economic, technological, cultural or knowledge resources, and I call this context the health resource environment. Now, of course, health ecosystems in advanced Western economies have access to very different resources than those in lower income countries. And so in this sense, like natural ecosystems, the situation or the place of location of health ecosystems can be used as an important context to distinguish them too. So using these contexts, we can now identify individual health ecosystems that exist in multiple locations, in different countries, across multiple regions or communities. And just as in natural ecosystems, individual health ecosystems are also adjacent to one another. Adjacent social ecosystems such as housing, education, energy, food production and consumption contain many of the social determinants of ill health, and so we must add these alongside our framing too. As doing so means we can now look much broader for health value creation opportunities, with a wider canvas to search and understand what's happening. So okay, but there's actually just one more context we can use to frame a health ecosystem. And for that we need to head on over to the second component of the framework, that of functioning. So the second component of the framework reveals how health ecosystems function and the actors and the other elements that constitute them.
And again, we can learn from ecology here, because to survive and reproduce, species in individual natural ecosystems not only compete with one another, but often interact in more mutually beneficial relationships by sharing resources with each other. And in all natural ecosystems, certain species work together to perform a number of complementary tasks that are vital to maintain or recover the health of the primary producer species, and therefore the health of the ecosystem overall. Now, ecologists call these teams of species functional service groups, and they can be identified according to their nature of their interaction with the ecosystem or their purpose. So whether in functional service groups or at the level of all species interactions, natural ecosystems are in effect resource sharing and integrating service systems. And the same is true of health ecosystems, or more correctly, health service ecosystems. Influenced by values, their role, actors in the ecosystem, whether people, patients, clinicians, industry players, providers and government, develop, share and integrate resources to access, perform, obtain, enable or use health services. And these services can be defined according to their purpose, whether to prevent a particular illness, to improve or maintain or recover the disease or condition of a beneficiary actor, the patient or population group that benefits from these services. So we can define the purpose of an ecosystem from the point of view of a beneficiary actor too. They may be seeking to improve their personal quality of life, to manage a chronic condition such as pain, or recover from a trauma, for example. So to complete our framing, we can add one or more purpose to further distinguish, to identify an individual healthy ecosystem. Now, when we set purpose, we also kind of frame an intent or a direction of future value creation or transformation. And by knowing a purpose, and especially what's preventing actors from achieving it with the resources available to them, we can inform a more robust search for future possibilities for improving, transforming, maybe even disrupting an individual health ecosystem. So here now are a few examples of fully framed health service ecosystems, showing the four contexts of purpose, situation, the health resource environment, and a beneficiary actor, along with the adjacent ecosystems. So with framing and functioning now defined, we can think about studying an individual health ecosystem in order to better understand problems and better discover new possibilities. And in order to do that, let's move on to the third component of the framework, which I call structure. So in all natural ecosystems, ecologists define a hierarchy consisting of different levels and types of interactions between and within species. Starting with a single organism at the lowest level, then a single species, each higher level defines a wider variety of interactions between increasingly more diverse populations and communities of species, up to the highest level of the ecosystem overall. Now, it just so happens that it's possible to identify a universal hierarchy of actors and interactions within any framed health service ecosystem too. Consisting of 8 levels, each level denotes a particular configuration of actors, or what I call a co-creation practice, interacting in different ways with their own and other actors' resources to provide, perform, and obtain health services. So let's look at these different practices briefly. So at level 1 of the hierarchy are interactions within and between the body and mind of beneficiary actors. Level 2 defines the personal interactions that beneficiary actors have when on their own and with their and others' resources, such as those provided by industry, devices, drugs, and other technologies. Level 3 denotes the social or peer interactions that beneficiaries have with their family, friends, or other people with similar conditions. Levels 4 to 8 then progress through increasingly more complex practices that take place between the beneficiary and specialist health actors, and within and between health service teams, organisations, and overseer bodies.
So for any framed health service ecosystem, we can map the practices of actors using this hierarchy. We can also map current pathways through them. Doing so provides a universal structure for organising inquiry and for capturing deeper understanding of ecosystem level, practice level, problems, patterns, relationships, trends, and of course, opportunities. And what's more, all this can be done before we even need to start thinking about or assuming what solutions might be best. So having an objectively defined and universal hierarchy of a healthy ecosystem means that we can reveal novel possibilities for intervention or change of any kind, not just for new technology, drug and device innovation, but also for innovative provider health services, for community initiatives, for new forms of collaboration, and for new health policies and programs. We can also learn how to design new health ecosystems altogether. So to know how to do all this more effectively, we need to move along to our final component of the framework, that of adaptation. So all natural ecosystems are in various states of dynamic adaptation, and any given state depends on the balance of available environmental resources, the health of the primary producer species, and the presence and capabilities of certain key species and functional service groups. Some ecosystems are in a sustaining state, some are new and emergent, others are rigid or collapsing and may be losing or have lost their resilience to cope with the decline of energy resources and therefore the decline of the primary producer. In most cases, though, a natural ecosystem really can contain a mixture of all these states in different degrees. And the same is true of health service ecosystems. They too are in various mixed states of evolution, adaptation, stability, or decline. And so using the structure we defined, we can now see if, where, and how our individual health ecosystem is changing. We can identify those different states that exist within it. So using the structure of the practices at the different levels, we can now see within level, top-down, bottom-up, adjacent and disruptive forces of change, and respond to the weak signals of those forces more appropriately. We can understand the influence, nature, dynamics, and consequences of lots of different factors on the nature and form of adaptation, or the adaptive capacity of the ecosystem. These include factors such as beneficiary and professional actor capabilities, their knowledge and resources available to them. We can look at any variations in actor values, which can sometimes and often lead to conflict. We can look more closely at the different resource types, the costs of those resources and their use, including the range of different technologies available. We can better understand care access and equality issues, and also the nature and influence of those social determinants in adjacent and clinical social ecosystems. We can look, very importantly, at the root causes of health problems and understand how all these factors affect beneficiary actor outcomes and why and how these outcomes vary. Because when we understand these factors more deeply, we can also better discover and assess more valid and more novel opportunities to intervene or to improve a health ecosystem, or even transform it. So instead of thinking in limited terms of improving outcomes and reducing cost, we can now adopt a wider lens to discover and design value in a health ecosystem, one that sees problems and opportunities differently, and one that helps us identify how and where to advance the adaptive capacity of different levels of or an entire health ecosystem altogether. And once again, the structure, the 8-level hierarchy, helps us here, because each of the levels in the hierarchy tells us the types and combinations of design approaches we can use to help us do so most effectively. Because when you embrace the ambition of evolving adaptive capacity, you'll also understand how to develop your own adaptive capacity. And when you do, I guarantee you will develop more novel ideas, designs, business models, technologies and services, teams and organizations for improving and transforming the well-being, the health of health ecosystems, and not forgetting, most importantly, people and patients' healthy lives. In short, you will acquire new or better imagination for seeing and designing novel possibilities for value creation, interventions that are desired by actors and sought by decision makers. You will also acquire better understanding and insights for shaping those ideas and technologies that you're already working with.
So there we are, that completes this introduction to the Health Value Design framework. If you'd like to explore and play with some of the components some more, then why not attend one of my upcoming half-day Health Value Design masterclasses being held at different locations in Europe, US and Canada over the next 2 to 3 months. Alternatively, you may like to download the comprehensive publication that's available on the website. Or, of course, if you'd like to discuss application of the framework in the context of any of your particular health ecosystem challenges or ambitions, then please don't hesitate to get in touch. Thanks for watching, and I hope to hear from or see you soon.